Knock, knock. Can I come in?
Yep.
Can I get your full name and your date of birth?
Cassie Craft, 103088.
Do you have any allergies, Cassie?
No.
No allergies. Check your band to double check here. Looks good. No allergies. Are you having any pain today?
Yeah, my left knee kind of hurts.
Your left knee?
Yeah.
Okay. Well, I'm Corey. I'm your nurse. I'll be on until about 8 o'clock. I got about another hour for it with you. What would you rate your pain in your left knee? 0 to 10, 10 being the worst.
6.
6? What? Can you describe that pain for me?
It's kind of like a stabbing pain.
Stabbing pain. Do you need some ice or some Tylenol? Or
Yeah,
what
some
usually helps?
some ice might help.
Some ice? Okay, we can get you some ice after this. We're going to do a full assessment on you. We'll start by getting a set of vitals. Grab your blood pressure, your temperature here, and your oxygen saturation. And we'll start with your lungs. Actually, first off, we'll start with your cognitive status. Can you tell me why you're here?
I broke my leg, I think.
Yep, that's right. Can you tell me where you're at specifically?
The hospital?
Yep. What time of day is it?
It's like dinner time.
Yep. 6 o'clock, 7 o'clock now at night. Okay, so first we'll start with looking at your head. Check for facial symmetry. Look symmetrical. Check the skin integrity behind your ears, your nares, the back of your head. It's all clean, dry, and intact. And I'm going to do your arms next. We'll check your bony prominences, your elbows here. It's all clean, dry, and intact. Can you squeeze my hands with your hands for me? Perfect. I'm going to squeeze your nail beds, check your capillary refill. It's less than a second. I'll check your pulses here, and I'm going to check them for 30 seconds. Your radial pulses for 30 seconds. And then the last 30 seconds, I'll check your respirations without you knowing. But I didn't just tell you that. All right. So no numbness or tingling in your hands?
A little bit.
A little bit? Which hand?
My left hand.
This one? Is that normal for you?
Yeah.
How long has that been going on?
A couple years.
Okay. Now I'll take a listen to your lung sounds. I'm going to go in an S pattern, listening at each of the 7 spots for full respiration. I'm going to go underneath the gown here. Lungs are clear. Skin on the chest is clean, dry, and intact. I'm also going to listen to your heart while I'm down here. I'm listening at the 5th intercostal left mid-clavicular spot. I'll listen to your apical pulse for a full minute. And it's regular. Now are you able to move over on your side by yourself, or do you need assistance?
I can move.
Okay. And now have you been transferring to a chair by yourself or with
Yeah.
assistance?
I can get to a chair.
Okay. And how about ambulation to the bathroom?
I need a little help getting to the bathroom.
You need one assist to the bathroom? Do you usually use a walker or cane?
Yeah, either a walker or a wheelchair.
A walker or a wheelchair? Okay. So now on the back, I'm going to listen to lung sounds again, moving in that same S pattern. At the same time, I'm going to assess the skin of the back and the buttocks. Both are clean, dry, and intact. Lung sounds in the back are clear. Are you having any shortness of breath?
No.
Not at rest with activity or talking?
Nope, I do okay.
Okay. Next, I'm going to assess your bowel sounds. And skin on your tummy looks clean, dry, and intact. Are you able to pass gas?
Yep.
You having any nausea, vomiting, diarrhea, or constipation at all?
No.
When was your last bowel movement?
Last night?
Last night? All right. Was that formed
Yeah.
or loose? Formed. So now I'm going to listen at each quadrant for up to a full minute. Bowel sounds are all active. I'm going to palpate your stomach. Can you tell me if there's any tenderness right now?
No, it doesn't hurt.
Okay, and soft, non-tender. Next, we're going to take a look at your peri area. Now, are you experiencing any frequency, urgency, pain while urinating?
Nope.
Okay, and have you been able to make it to the bathroom when you needed to use, when you needed to urinate or have a bowel movement?
I'm continent.
You are continent. Okay. And I'm going to assess the skin in the groin area. It's clean, dry, and intact. No redness or moisture. Okay. So you've been using the toilet for both urination and having a bowel movement. Is that correct?
Yeah.
Okay. So you don't use the incontinence pads or a Foley catheter or
Nope.
or a condom catheter. All right, next we're going to take a look at your legs here. So we're going to assess the skin, all prominent bony prominences of the skin. We're going to assess color, temperature, assess for moisture, edema, palpate for edema. Looks like there's +1 edema to bilateral lower extremities. Next we're going to palpate pedal pulses. They're bounding, so we're not going to use a Doppler. We're going to assess skin of the feet, the top, the bottom, the heels. Make sure they're all clean, dry, and intact between the toes on each foot. Nope, you're good. Can you push against my feet? Good. All right. Okay, so we're going to assess the PICC line here. And looks clean, dry, and intact. Was the dressing changed this morning as it states?
Yes.
Okay. Now back to your feet. Do you have any numbness or tingling in your feet?
A little bit.
A little bit. Is it on that left leg again?
Yeah.
Left foot? Okay. I'm going to lower your bed here. You've got water here. I'll wash my hands. Now, have you used an incentive spirometer before?
No.
I better teach you that before I let you lie down. Okay, so this specific incentive spirometer, what you want to do is you want to purse your lips tight around the mouthpiece here and inhale through the machine. As hard as you can. You want this all the way to the top. This yellow piece will rise. Does that make sense?
Yep.
All right, can you demonstrate it for me?
Sure.
Perfect. Okay, now I'll let you lay down. Put your bed back down. Again, your call light is right on the right there. Do you have any other questions or concerns for me at this time?
Nope. If you could just get the ice pack.
Yeah, I can grab you that ice pack. Again, my name's Corey. If anything else arises, you let me know. I'll get your call lights again is on the right side. Here's your water. The room is free of clutter.